of taking medicine, and there will be obviously there will be some disadvantages also, because everything has its some merits and demerits. So now I'm talking about the demerits. So it is not good for me as a medicine is a internist, or I would say as a medicine resident. So it is not wise to talk about the demerits, but uh, in true world, in true sense, I have to say what are the demerits of this subject. Number one, day by day, the super specialty seems essential for some metro cities. This is one of the demerits, because now for a little or minimal problem, people used to go to super specialty like for some little pain abdomen or gastritis, people go to gastroenterology in a big town or metro city. So this is one kind of problem. Super specialty seems essential, but this is not applicable for a semi town, or I would say village, or uh, town to a town with grade lesser than some metro city, like some suburban areas. So it is not essential at all. So this can be considered as merit, but super specialty seems essential in metro cities like Kolkata, Bangalore, Chennai, and Delhi. But this is one demerit. Number two demerit is long time for settlement if you are planning for super specialty. So if you want to pursue cardiology, then neurology, it will take at least 10 to 12 years. Then number three demerits, I can say it requires constant updating facts, because uh, day to day the therapeutic aspect or the treatment protocol is changing. Suppose you are giving a patient this drug, next day the association is saying this drug is not beneficial. So this drug is superior. So you have to be updated with knowledge. So if you know one surgery, by the knowledge of that surgery, you can throughout your life you can do the procedure. Because in medicine, if you go with your past knowledge that is acquired 10 to 15 years ago, that will not accept it. So it you have to be updated. So it requires constant updating facts. And uh, and another thing, it requires patient dealing. And patient dealing with educated patient is really difficult nowadays, because everybody is having nowadays big phones, smartphones, and Google. So everyone is nowadays Google doctors. So they will come to us with plenty of what I say queries. So you have to deal with all these queries, Google doctors. So be aware before taking medicine. You have to clear all these facts about Google. So everyone is doctor today with the help of Google. So this is all about merit and demerits of medicine.
Okay, Dada. So we got to know all the merits and demerits, and I think all most of them are applied to other subjects also, like the similar things. But yeah, exclusively for medicine, some of them. So yeah, thank you.
Yes,
So
yes.
I would like to go to the next question.
I
That we would like
Yes,
to.
yes. I will definitely go to the next question, but I have seen there are three or four queries in the message section,
Yeah.
but uh, I will definitely clear those out. But
Sure.
I am asking all the participants, if you have any doubt, you can ask me in the comment section and messages section. And if you have any message for me, then you can also write it down in the comment section or messages section. So everybody
Yes.
is welcome from
So
this
yeah,
aspect.
you can keep asking questions in the comment box. We'll take them after one to few questions. You are ready to do that. So our next question will be, Dada, we would like to hear a case from you, like which changed your life, which got you a lot of new experience as a MD medicine. So, a unique case.
Are you asking about which case changed my life, or
Yes.
which case uh, is it about life or upturn of life coming into this profession? Are you asking about that?
Yes, you can take it like.
Yes, yes, yes. As I can share with all of you. there is something that I experienced really early in my life. That is the concept of death, because my sister lost her battle to leukemia when she was 8. I was only 10. I was, I think, in fourth standard. So my father could not afford her treatment. She was suffering from leukemia. So because of some financial constraints, so I have seen the struggle of a poor, what I would say is a poor patient, the struggle, the battle, the suffering. So from that day onwards, what I have decided, I will opt for this medicine, and after completion of my studies, I will definitely do something for those people who are suffering because of some financial constraint. As per I remember, when my sister was battling with this deadly disease, my father could not even afford the uh, what I say, could not even afford the minimum travel expenses to bring my sister in Kolkata, because my home is 450 kilometer away from this town, Kolkata, because I am from a very small city of this West Bengal, that is Gangarampur, from district Dakshin Dinajpur, South Dinajpur. So it was not affordable for my father to bring my sister to Kolkata. So um, she suffered a lot, and lastly she lost her battle when she was 8. That day I have decided, so I will go for the subject, whatever it takes. I will fight, and I will definitely come up with flying colors in this aspect or in this profession. So eventually uh, uh, কি বলবো, মানে ভগবানের ইচ্ছে হয়তো সেটা পূরণ হয়েছে, and definitely I have worked hard a lot during my MBBS days, and the main support system was motivation from my school teachers. They have supported me a lot during the whole phase of class 11 and 12 preparation, because uh, আমার সময় কোনো কোচিং ইনস্টিটিউট আমার ক্ষেত্রে ছিল না, বাট মাই টিচার্স supported me a lot. Not only my school teachers, my, even after coming to UG or undergraduate course, my college teachers of my UG colleges, UG college also supported me a lot to uh, to do some fine tuning of this profession. That is why the result you can see. Um, so this is the most what I say. This is the most important thing that changed my life actually. And after joining this residency medicine, so I am going through various cases, challenging cases rather, because now I am doing residency in a tertiary care, big tertiary care hospital like SSKM. So IPG and SSKM Hospital Kolkata is a tertiary care hospital with plenty of cases or variety of cases. So I'm going through all the cases, and I am learning day by day. So my learning curve is gradually increasing. So mm that is stronging, and that is making my basic much more stronger. So this is all about my profession, and like what I say, the most important thing that are changing my life day by day. So that's all I can say.
Uh, so we are sorry for your loss, but your story made our heart heavy. But as well as inspire, the story was really inspirational because many of us are from those like small towns and have come to this far,
Yes,
being
yes,
being a medical
definitely.
doctor.
Uh,
Yes.
uh, what uh, I advise for my juniors. So if your dream is big, so if you work hard, so nobody can stop you from acquiring your dream. So as I always say, hard work never go unrecognized. So work hard and come out with flying colors. Don't think I am belonging to a very poor family. I am from a very small town. And another thing, some of you might think I am from a Bengali medium school. My friend is from a big school, so my background knowledge is poor. Don't think so. I am also from a government Bengali medium school. So actually, this all these subjective these are all subjective things. The background status actually doesn't matter. If you work hard, that will definitely pay off. So all the best, everyone. So dream big, and you will definitely acquire after working hard.
So I think we have got our mantra, that is dream big and work hard. Okay, thank you, Dada. I would like to go to the next question. This might be the last question, then we can go to the comment section questions. Uh,
Okay.
what is the scope of MD medicine in 25 years from now?
Actually, as I have already said in my previous discussion, discussing the first, I think, second question. So it is again a debatable question. What will be the scope of medicine in uh, 25 years? Because first of all, I am not God, so it is not possible for me to predict what will be the scope of MD medicine by 25 years. And another thing, the day by day, the AI, the artificial intelligence, Google,
Yes.
so is making the things much more complicated for us also. It is making the things much more simpler for common people. But after getting information from internet, the patient is making all the things complicated. Number one. And number, why this is debatable question? Because some of the medicine residents or some people think super specialty is really needed after passing MD. So those who are thinking super specialty is really needed after passing MD medicine. So for them, I would say there is very less scope after completion of MD medicine. And those who are thinking it is okay with the internal medicine, so for those there will be plenty of scopes after completion of medicine. So I will go through what are the scopes after completion of MD medicine. And about MD medicine 24 5 years from now, I think that will be around 2000 2048 or 2050. It is very difficult to say what will be the scope, because day by day the most challenging thing are coming. The procedure, the intervention, all these things are updating. Definitely, as it is a evergreen branch, it is a brainstorming branch. It will be evergreen as it is now. And the thing is, what are the scopes after completion of MD medicine? So that you should know. And the another thing, the term super specialty is a misnomer, because there are broad specialties, and this should be called as subspecialties, because medicine is the most broad specialty, and among these the subspecialties are cardiogastro, because these are one part of medicine that should be called as subspecialty. So yeah, I know, because after completion of MD, they will have more knowledge compared to a medicine resident, because but they are subspecialties of medicine. So and now what is the scope of MD medicine or after completion of MD medicine? And MD medicine is a very respected or valuable degree in the field of medicine, because it provides the strong foundation for the diagnosis and treatment of wide range of medical conditions. Some individuals may choose further specialization through fellowship or super specialty. This can provide a specific area of interest. How it's not necessary for everyone to go for MD internal, what I say, MD medicine, MD medicine, super specialty. And this decision is to do is often based on some individual career goals or interests. And as I say before, uh, if you are thinking about practicing in a village, so village or semi town, you can do well with your MD medicine. Because but if you are planning to uh, you are planning to stay in a big metro cities like Kolkata, so MD medicine will be difficult 25 years from now. So you have to definitely opt for some super specialty. And there are some others plenty of options you can opt for even after completion of your MD medicine program. Like you can go for some academic activities, like you can join a medical college. Even 25 years, after 25 years, there will be more number of, even twice or thrice the number of medical college will increase. So definitely there will be demand of some academic physician also. So you can opt for some academic curriculum like assistant professor. You will upgrade to further associate and professor. So uh, this will help you in your future. So you can opt for some global health specialist. You can join some global health program, like you can join WHO or some global health organization. Even you can join some research program. Nowadays various research is going on based on the internal medicine knowledge. As you have seen, the research applied aspect of research aspect during your COVID pandemic, because doctors have developed multiple vaccines in a very minimal time, even the rapidity of pandemic, even in rapidity of pandemic. So you can opt for that also. It will not help a person, not help a patient in person, but it will help the whole society, or or what I say, whole uh, population of whole globe actually. So about so in this way, this question is debatable. It is not easy for me to tell what will be the scope. But trust me, there will be plenty of options even after 25 years from now or today. So you can opt for anything. But if you want to stay in a metro city, super specialty will be essential. So you cannot just run away from super specialty. You have to do super specialty if you are planning to stay in a metro cities.
So, as you have already said that the medicine is really vast and difficult to master, as a lot of real knowledge is.
No, 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 no. Actually, uh, what I'll say, this is vast but not difficult. If you love
Okay.
this subject, this is very passionate.
Okay. So,
It is vast, but
yes.
trust me, it is not difficult. If you are passionate about this subject, if you love this subject, it is very easier.
Yeah, like a lot of knowledge need to be gathered to master the subject, right? So, how come
Yes,
it
yes,
doesn't?
definitely.
Yes. So, doesn't it get frustrating sometimes? It is a question from one of the participants.
Sometimes it is frustrated. Why you will understand during your postgraduate residency why it is frustrating sometimes, because you have to because someone will praise you after solving some problem case or challenging cases. Even some rude talk also you will hear during your residency from your teachers, professor, even from patients. That is there. Those are sometimes depressing, and the depressing things can also come from the workload, because if you get enough time for you to, for refreshment, sleep, or for your food, but in medicine you will get time for your little refreshment like food and sleep. But in some residency like general surgery, orthopedics, gynae and obs, it is quite hectic. But in case of medicine, the the what I say, the depression, harassment is lesser to a less is lesser compared to the other specialties. So sometimes it is depressing, harassing, and especially the first year residency because of huge workload. But after completion of first year residency, when you will receive a bunch of juniors, then it will be easier for you.
Yes. So
I
the
think many people have asked me about the NEET PG preparation strategy,
yes,
or how will one prepare for the NEET PG or next.
exactly. The change is coming. The next is coming. So how should it change our preparation style or the our approach to the subjects?
Yes, yes, yes. Definitely, I will go through this because this is the most common concern by all the students. How will someone prepare for the NEET PG or so-called next? I think next is going to happen after 2 to 3 years, as proposed or as proposed by our health minister. So don't worry. Don't think it will be a 3 days exam. Just relax and prepare for your NEET PG exam. So I must say about the NEET PG preparation strategy, the strategy you should follow. I will share one video that I have made few days ago about the NEET PG preparation strategy. So I think just 1 minute. I am sharing the video link in group. You can go through these videos, but I will definitely also discuss some points regarding the NEET PG preparation strategy that
Yes.
will help you in your preparation. Okay. So first point is concept building. So if you want to think কি সব পড়ে নেবো সব হয়ে যাবে একদিনে, হ্যাঁ, so it will be very difficult for you. So concept building is important. So you should be regular with your classes from your first professional MBBS. So প্রথম দিন থেকেই ক্লাসগুলো তো ভালো করে করা উচিত অবশ্যই। তো make your concept as crystal clear. So read your textbook carefully. If possible, just go through the those subjects during your preparation. Suppose if you are in first year MBBS, you should read anatomy, physiology, and biochemistry. Along with not only you should read the textbook, you should also go through the various MCQ book, and you can go through any what I say any online platform for clearing the concepts. And after first read you should go through the MCQ also, because this will make the preparation much more easier from the first year itself. Because my my strategy was also like that. In first year itself I have completed the anatomy, physiology, and biochemistry MCQ. I have solved the MCQs from those subjects. During second year, I have gone through the MCQ book of pathology, pharmacology, and microbiology, etc. So you can go through the MCQ book or any online platform MCQ series from your profession, as you are dealing with the subjects during your what I say MBBS curriculum. Then so one is concept building. So you should read the subject carefully. So for intern and house staff, it is advisable for me, those who are thinking it is huge. Suppose the platform like Marrow, Dams,
Hello.
Fliptrader is giving a huge chunk of knowledges and
Hello.
information, so it will be difficult for you. Then they for those it is advisable you
Sorry,
can
from
go
where?
for some revision videos that I think
No,
those
no.
are also
Sorry.
available in online
No.
platform, and you can directly go for the MCQ section and practice MCQ. So concept building is required. Then is integrated approach is required, because nowadays question are not direct MCQ. It will be some integrated knowledge based question, because it will be mixed of anatomy, some knowledge of orthopedic. They will not ask you direct question. It is not like which nerve palsy causes wrist drop. It will be, the question is not like that. The question will be like that. Suppose Saturday night after having party, late night party, one 32 years old man is complaining about, next day morning complaining about some tingling sensation or tingling sensation in the hand with inability to extend his wrist. That means wrist drop. So there is inability to extend his wrist. So as you can easily understand, if you uh, solve the complete, what I say, the problem. So it is a wrist drop, and the question will be not like which nerve damage causes this situation. The question will be like there will be one image of the bone humerus, and one or two, three or more points will be marked. Like around surgical neck, a point will be there. Around the shaft of the humerus, B point is there. Around the lateral condyle and medial condyle of the humerus, there will be points C and D. And they will ask at injury of at which point will cause this situation. So first you have to know this situation is wrist drop. Second, you have to know radial nerve damage is causing wrist drop. Second, the third thing that you have to know in relation to humerus where this nerve lies. So as all of you know that radial nerve is passing through the radial groove, radial groove that is overlying the shaft or middle part of the humerus. So injury of the middle one side of the humerus or uh, what I say radial groove will cause wrist drop. So nowadays the teachers are fond of asking this type of question, some integrated knowledge based question. So you should read all the subjects, then you integrate the knowledge that is acquired from every subject. And uh, now some of you may asking how will you integrate the knowledge? It is very difficult to integrate the knowledge of all the subjects. So the preparation strategy should be like whenever you are planning to read cardiovascular system, first you should read the embryology, how the heart is developed, and what are the derivatives of heart tube and how and what are the congenital anomalies. Then you should go for the heart anatomy like coronary blood supply, okay, then the chamber and structure of heart. Then you should read the coronary physiology or heart physiology, cardiac output, blood pressure regulation, various reflexes, stroke volume, etc., cardiac physiology, action potential and all. So I think what I am talking about the cardiovascular physiology. After completion, you should go through the cardiovascular pathology like some rheumatic heart disease, infective endocarditis, myocardial infection. And after completion of the pathology part, you should read the cardiovascular drugs like antihypertensive, antiarrhythmic, anti drugs used in heart failure. So you have already read the embryology, anatomy, physiology, pathology, pharmacology part. Then you should go for medicine aspect. For the medicinal aspect, gross overview of the all the problems related to cardiovascular system. Then you should go for also pediatrics part also from cardiovascular point of view. And after completion of the cardiovascular, starting from your first year anatomy to last year, that is medicine and pediatrics, you can easily integrate the knowledge by yourself, how the anatomy is related with pediatrics, how the drug is essential for those pathology. So you can, it will be easier for you to integrate the knowledge. So this is not only applicable for cardiovascular, it is also same for renal physiology, renal anatomy, starting from some renal situation in pediatrics like nephrotic syndrome, nephritic syndrome, in pathology also, along with some histopathological changes. So you should focus on one domain of subjects during the last phase of preparation, and you should integrate all the knowledge that you have gathered from different aspects of MBBS. Next is solving question bank is important because after solving question bank, so you will get to know what topic is important for exam. Suppose if you go through the past year question, PYQ, so after reviewing past year question, you can easily understand the important topics of every subject. So question solving attitude is very important. Then custom module, if you go through any app, especially any preparation app, online platform, so custom module is also important. Next, giving test is very important. Suppose if you are only reading, that will not help you. Rather, giving test is important because you have to test how your preparation is going. So you should go through regular test series, grand test, subject wise test. And another thing is revision. As I have said in my video that I have shared in the group, that is revision means retention. More you revise, more will be retention of knowledge and information. So revision, revision, revision. That is the goal of ultimate success. And revision will what I say, revision will convert your short-term memory into long-term memory. Otherwise, it is not possible for you to retain all those knowledge. So revision is important. Another thing is social media. Keep some distance from the social media during the last phase of preparation because it will hamper your, it can hamper your study. It is, if it is hampering, so refrain yourself from social media and some toxic relationship with friends also, some negative vibes, stay away from the negative vibes because during preparation positive vibes is important because those who are encouraging you during your preparation, stay with that, stay with all those people and stay away from some toxic people, those who can say, আরে তোর দ্বারা হবে না, কিছু হবে না, so এবার হবে না, পরের বার হবে, কিছুই পড়িসনি, stay away from these people. Say, and I must do. Okay, so that should be your motto. And never give up, believe in yourself, you are never late. There are no set time period for starting your preparation. You can start preparation from any day, and consistency is important. So be consistent with your study. Self motivation is important, because no one can motivate you better than yourself. তো আমি যদি 1 ঘন্টা ধরে এখানে জ্ঞান দিই, তাতেও কেউ মোটিভেট হবে না যদি সে নিজে না মোটিভেট হয়। সো সেলফ মোটিভেশন ইজ ইম্পর্টেন্ট, and break is also important. Don't just study. Sometimes you need some break for yourself too, for your brain too. So study at least as much as possible, but in between you should also opt for some break. Go out for some movies with your friends, and you can opt for some, what I say, OTT based some series. It should, if you go through some medicinal aspect series, it will be good for you. Like, according to me, it will, if you go through House MD or Good Doctor or Grey's Anatomy, it will also, it will refresh your mind too, and that will not hamper your preparation. And appropriate platform choosing is important, because, and whatever your platform is, trust the platform. Suppose if you are thinking, my friend is doing marrow, I am doing cerebellum or prep ladder, I will not be able to crack the NEET exam. So this will not work. You have to think, I am the best. So that should be the goal during your, that should be the motto during your preparations. Whatever the source, is it dams or Bhatia coaching institute, prep ladder, or cerebellum, anything. I am not promoting any channel, so you may find some promotion in my videos which I have shared, but don't just go blindly with one source. Whatever the source, you should trust the source, because every platform is teaching the students so nicely and carefully. If you can read all those topics or subjects, you can easily crack the NEET, whatever your source is. So trust the source. And about the exam day preparation, and exam phobia is a big fear during, before the exam. So do not fear, keep, trust yourself. And if you feeling any difficulty, so, and if you get depressed during your preparation, seek medicine, seek help from any psychologist, and if needed, antidepressant can be taken. There is no shame taking antidepressant, because it is depressing sometime, and it is, if it is causing major harm, some physical issues, you can go for medicine. So medicine or counseling. And sleep well, at least 8 hours a day. It's not like just only NEET PG preparation, 30 minutes sleep a day. So every corner of our lifestyle is important during preparation. So prepare wisely. That's all.
Thank you, Dada. I would like to summarize because time is like short and constrained. So for NEET PG
Yes, yes.
preparation, first of all, you should go all the subjects, go through all of them like a basic one. Then, as you said, we should go by like system by, right? From
Yes, yes.
embryology to the treatment part and throughout the pathology. Then we can make our own notes or as we like it to go through all the process. And further all,
Exactly.
yes, so further all, uh, we can do question banks, image based questions, especially as you said, integrated questions, inter subject questions, so that we can interpret what the question is and what is our goal in that question. And finally, we should follow like one platform what we are following, like so not taking all the notes from everywhere, like
Exactly.
following one thing at a time. Okay, thank you, Dada.
Exactly. If you are following the notes from 2 to 3 platform, it will rather complicate the things. And the
Yes.
last thing I should tell,
Hmm.
if you have any queries, you can ask me in the group. I
Yes.
can answer the question personally in DM. So very now, lastly, I will thank GIMS for giving me the opportunity to connect with the young minds of future specialists. So thank you, GIMS, and thank you all the participants your uh, for your precious time. Thank you.
Thank you so much, Dada. I think most of them would like to ask questions in the group, and if Dada is okay to share his email, then you can also ask him in the
Yes, yes,
email.
I will definitely share the email in the group, and I will also definitely share. I will also share my personal contact number. If you have any doubt or queries, you can ask me personally after just introducing yourself. So you can ask me
Yes.
personally.
Sure. So, Dada, it's all right. Like, it's an official discussion. There is a link in the group. I will ask. I'll try to send it once more. So before leaving the meeting, fill this link to get the certificates. It is mandatory. Okay. It will be open for 10 minutes. Yeah, you can see the link. I will still again do the share is once more. Thank you, Dada. Thank you so much. Have a good night.
Welcome. Good night.
Good night. Okay, so fill this form carefully and make sure to get the certificate. Okay, thank you everyone. Thank you for joining the meeting.